Hello and good morning. Thank you all for tuning in this afternoon. My name is Ryan Boyles, the owner and editor of Health News Illinois. We have a wonderful panel with us today to talk about a really important issue right now, and that's the future of health equity initiatives. So, thank you so much to our esteemed speakers for sharing some of their valuable time with us today. I'm thrilled to introduce Dr. Samir Vora, Director of the Illinois Department of Public Health, Dr. Eric Makaitis, the CEO of Cook County Health, John Peller, CEO of the AIDS Foundation of Chicago, and Ladarius Curtis, the Director of Community Engagement from Westside United. Unfortunately, Nicole Willis will not be able to join us this afternoon. Before we get started, I want to thank the generous sponsors of the Health News Illinois virtual event series. These important discussions would not be possible without their support. So a huge thank you today to Molina Healthcare and United Healthcare. Additional slots are available to sponsor our future virtual events. If interested, please contact me after today's discussion at rvoyles@healthnewsillinois.com. Health News Illinois is an online, nonpartisan news service. In addition to hosting events like this, we also publish a daily email newsletter. If you're not yet a subscriber, I encourage you to sign up for a free trial. You can do so on our website at healthnewsillinois.com or by emailing me again at rboyles@healthnewsillinois.com. I want to give an extra shout out today to Molina Healthcare, today's featured sponsor. We are very grateful for their generous support. Here to say a few words is Matt Wolf, the plan president for Molina Healthcare.
All right, thank you for the warm introduction, Ryan. Good afternoon, everyone. My name again is Matt Wolf, plan president for Molina Healthcare of Illinois. On behalf of Molina Healthcare of Illinois, I'm proud to be here as the sponsor of today's conversation on the future of health equity. Prior to kicking off what I'm sure is going to be an engaging panel, I'd like to share some information about Molina Healthcare of Illinois and our commitment to the state. Molina Healthcare is on the front lines of the evolving healthcare landscape and have been providing government-funded quality healthcare since 2013 right here in the state of Illinois. Since then, our commitment to improving the lives of the under-resourced Illinoisans has remained steadfast. In Illinois, 12% of families live below the federal poverty level, which often translates to unstable healthcare coverage, housing and food insecurity, and challenges in accessing transportation. Individuals living below the federal poverty level are also at higher risk for mental illness, chronic diseases, mortality, and lower life expectancy. Last year, in collaboration with the Molina Cares Accord, we are proud to announce a $3.7 million investment in the Molina Cares Illinois Health Equity Initiative. In total, Molina has dedicated approximately $5 million to improve equity in health outcomes for under-resourced communities in Illinois. Through this initiative, we have partnered with great community-based organizations, including but not limited to the Chicago Southside Birth Center, the Ada S. McKinley Foundation, the Awaken Foundation, the LGBTQ Center of Lake County, Bill of Heart for Kids, Heaven's Kitchen, the Rockford Police Department, and just recently, a new partnership with Food Smart that will be rolling out in coming weeks. The Food Smart Maturity Program aims to enhance the nutritional health, food security, and social determinants of health of pregnant members through a comprehensive set of services. In addition to these partnerships, we have developed population health programs with community-based organizations, providers, the Healthcare Transformation Collaboratives that have left a significant impact on over 20,000 Molina Healthcare of Illinois members. Through these programs, we address the most pressing healthcare needs, connecting our members to direct care and services that improve their health and well-being. Through our funding of 3 community health workers at Ada S. McKinley, Molina helped reduce health disparities experienced by Black African-American members, driving an overall decrease in emergency room visits and inpatient behavioral health admissions. We are committed to ensuring the members we serve in Illinois have access to the resources, services, treatment needed to address their healthcare needs. We're dedicated to meeting Illinois residents where they are, healthcare is local, and to connect them to services and resources that make a difference in the health and well-being. The work is crucial to Molina's mission to improve health equity. Discussions and panels like this one are important for continuing to think critically about the ways we are showing up for our neighbors amidst an ever-changing healthcare landscape. So we're glad to support this important conversation and look forward to learning more today. And with that, I'll turn it back over to you, Ryan. Thank you.
Thank you so much, Matt. I appreciate the comments and I always appreciate Moina's support for these discussions. And with that, let's just jump right into today's discussion. And Dr. Vora, I want to start with you. And just to set the scene a little bit, and I want each of our panels to discuss this a little bit, can you just tell us about the work that IDPH is doing on the health equity front? And why is this work so important for the agency?
Well, Ryan, thanks so much for having me for this really important discussion. And I'd say maybe even as kind of an opening comment and frame that many of the ideas in which we think about with health equity are the core of public health. And to sort of simplify it to being like, well, it's about two things. One, understanding why certain populations are healthier or unhealthier than others, and then trying to, number two, provide the support to give everybody a fair opportunity to live healthy and optimal lives. And that's a core mission of our public health department and really sort of rings true in our mission to re-envision health policy and promote health equity, prevent and protect against disease and injury, and prepare for health emergencies. And we have a number of programs and been a place where, through the leadership of Governor Pritzker, that we have worked on to improve across the state. And we think about this with our assessment of all of our programs, but I'm going to kind of go deeper on two in particular. One is the birth equity initiative that the governor launched really as we moved forward the FY25 budget, allocating millions of dollars designed to kind of close the maternal mortality gap. As many in the audience may know, there is a 3 times more likely chance for a Black mother to die from a pregnancy-related medical condition than a white mother. And that birth equity initiative included funding for IDPH to work on a birth equity blueprint, but also to work through a funding for community birth centers, a diaper pilot program, a child tax credit for families in poverty, as well as some legislation that really allowed for competitive reimbursement rates for doulas, lactation consultants, home visitors to really get back to that core community aspect of health. The other one is a new initiative in which we have worked around creating health equity zones throughout the state, a pilot initiative in which we've funded both Winnebago County and McDonough County to really think through unique community-based solutions. The program in McDonough County really works on obesity, sexually transmitted infections, and mental health. And in Winnebago County, we're really thinking about mental and behavioral health too. But just two examples, because really our health equity work, as we know in partnership with our other panelists on here, really works through all cores of public health, our healthcare systems, HIV work, community-based work, and really speaks to the goals of the Department of Public Health.
Fantastic. Thank you so much, Dr. Vora. Dr. Makaitis, can you just talk a little bit about some of the things that Cook County Health is doing on this front, and why is it so important for your organization?
Absolutely. And thank you for having me on. So I think our team is extremely proud of the fact that we've really been focused in the health equity space for as long as we've existed, over 180 years. And it's really been striving towards our mission, ensuring that everyone can live their healthiest life. It was already mentioned, social risk factors, right? We're doing a lot of work in food and housing insecurity, violence prevention, and then on the provider side of our system, really investing in programs and partnerships that aim to deliver more equitable care. That some of the more recent things that we've done include robotic surgery, offering doulas to birthing parents, expanding our behavioral health and substance use services. We could dive a little more into that. It's been a year-long work in behavioral health that's really focused around partnering with a lot of our community partners in the behavioral health space. In fact, last February, we did a program called Stronger Together that brought, I think, around 800 people together for the day, and has had a lot of follow-up discussions and collaborations after that, including $44 million in grant making that went out to our community partners to help really kind of tighten that safety net around the behavioral health space. Beyond the provision of care, I'm actually really proud of what we're doing in lifting up our communities in terms of access to jobs and careers in the healthcare field. We've had the Providence Scholarship in place now for 3 years. We have had over 180 students come through and have given out $3 million over the last 3 years in scholarships. So far, it's been for students in allied health or in the healthcare field. But it's been increasing and expanding. We're exploring how we launch that into the behavioral health space and healthcare adjacent roles and careers as well. And that kind of sparked a broader discussion around a more intentional and concrete pathway program that's start engaging come the spring. With some of our grade school students in the area, encouraging them into internships as the summer starts, and then exploring how we partner with our local, the City Colleges of Chicago in the area to expand our ability to do rotations on site as well. All of this obviously to try to improve and encourage, an interest in the healthcare field. We have an incredible workforce shortage on the horizon, but also, for our own purposes to encourage an interest in coming to join the Cook County Health Team.
Fantastic. Thank you. John, what are some of the things that the AIDS Foundation of Chicago are doing on the health equity front? And just why is this work so important for your mission?
First of all, Ryan, thank you so much for including me today, and I'm looking forward to the conversation with all of you. So, AIDS Foundation Chicago has, in our 40-year history, addressing racial health equity and disparities has always been at the heart of our work. And we have two organizational goals: ending the HIV epidemic and ending homelessness. And we do that work in a couple of different ways that really focus on and highlight racial equity. One way is through the Getting to Zero Illinois strategy, which is a partnership with the Department of Public Health. Thank you, Dr. Bora, for your leadership, and also the Chicago Department of Public Health, to really focus on reducing HIV rates for everyone, regardless of their race and gender, and with a particular focus on Black and Latinx people, particularly gay men who have sex with men, transgender women, and Black cisgender women, to address the high HIV rates among those populations. We are focused through Getting to Zero on really harnessing the incredible power of PrEP, which is HIV prevention medication, to reduce new HIV cases, and also the power of HIV treatment to not only improve the health of people living with HIV, but also to stop onward transmissions of HIV. And there are a couple key HIV programs at AIDS Foundation Chicago that really focus on health equity. One of them is case management supported through the Ryan White program. And we have a network of over 140 case managers who really focus on getting people living with HIV, who are mostly Black and Latinx, not just medical care and medications, but addressing their social determinants of health, which we know is so vital to addressing health disparities and improving racial health equity. The other really key program that we focus on is housing for people living with HIV. And we provide housing to about 1,100 people living with HIV a year. And we know that housing is just a critical problem that's driving racial health disparities and other disparities in Chicago, because Chicago's median household income grew by just 9% for between 2000 and 2003, but rents went up by more than 25%. So housing affordability is a really critical challenge that we need to work to address by providing people who are unhoused with housing.
Fantastic. Thank you so much, John. Well, Darius, just what are some of the things that Westside United are doing on the health equity front, and just why is it such an important thing for your organization?
Okay, thank you, Ryan, for having me. Bottom line is our organization, Westside United, our mission is to eradicate the life expectancy gap between folks who are born in the loop and the Black and brown people on the west side of Chicago. Before the pre-pandemic numbers were at about 15 years in terms of a life expectancy gap, but COVID has kind of uncovered and shed some light on how far the gap really is, and it's closer to 25 years in terms of its life expectancy gap at this point. So for us, it's vital to have certain programs. I think all of the programs that we're talking about right now, I've either seen or are working with some of you in some way, shape, form, or fashion. So thank you all for bringing your programs to our communities and using those resources. So for us, we actually have a maternal child health program that we built called Westside Healthy Parents and Babies through Lurie Children's Hospital, where we focus on doulas and lactation specialists, and also just that actual voice for the mother as she's going through the prenatal and postpartum process is really big. I think Dr. Voyer mentioned that we talked about health equity, life expectancy, and also infant mortality and morbidity rates. Garfield Park, which is right in the heart of the West Side, has the highest rate and has had the highest rate of infant mortality and morbidity for at least the last 7 years that I can recall. Just kind of going through that, so that's one of the programs that we really focus on and focus our folks with. We also work with the state program, not Invest Southwest, but Wellness West, which is a delivery of care system with CBOs and CHWs. So it's a combination of CBOs who go out with their CHWs and talk to people, provide them health readiness assessments so they can essentially get a better service or a better delivery of care to folks in our communities, which is vital in terms of having a better life expectancy overall and just understanding what's going on with your body and not treating just the symptoms and the problems, but also trying to find a cure. And as you need to do with life expectancy, take a look inward, kind of focus on your health, focus on the food that you're eating, and then build your environment from there. The last thing I'll say is through Westside United, we have our metrics framework that we use in terms of what's going on the West Side as a whole, whether it's cardiac care, homicide, obesity, and we just look at those raging factors and we try to use our community-based organizations who are already doing the work, provide them those research to expand those opportunities and capacity build them for all of the West Side.
Fantastic. Thank you so much, Darius. Dr. Evora, I want to go back over to you. As we talk about this, just what are the challenges that remain on the health equity front, and just what are some of the limitations that an organization like IDPH can do on this issue?
Well, I think we're all sort of marching towards progress. And I think what you've heard from the panelists is that the goal really is health for all. And partly the challenge is that we know that certain individuals are unhealthier than others based on a variety of different contexts. Often that we refer in the public health sort of lexicon as the social and structural drivers or determinants of health. That when we think of things like poverty, housing, you're from a often intentionally marginalized community, whether that is Black and brown communities, LGBTQ plus communities that are rural, that often don't have and have not had the same investment. And part of that we know, and you've seen from the history of these organizations, IDPH is about to celebrate soon its 150th anniversary, that we've all been marching towards that progress. And there's work to do. And I think we saw that first and foremost throughout the COVID-19 pandemic, that it can happen on a very specific emergency type issue, but it can also happen and does happen along a long course of things. We've referenced, maternal mortality. Dr. Makaitis referenced some of the work that Cook County is doing across different neighborhoods. John with HIV, Ladarius with kind of the zip codes, because we know, and we go down to the core of it. If you are born in certain neighborhoods on the south side of Chicago versus the Loop, there's often a 20 to 25-year difference in life expectancy. That's also true when we look at the collar counties out of Chicago compared to the deep rural counties, that this is an area that there needs to be continued, dedicated understanding and progress around. And I think that is the message that I know I want to convey working with these panelists. I know similarly is that there's a lot more work to do on this because we have those significant gaps. And although our organizations are concentrating on a variety of different aspects, if the goal really is health for all, healthy communities across the state, we have to really work together to close those gaps to ensure that people have the best kind of foundation to be as healthy as possible.
Thank you so much, Dr. Makaitis. I want to go over to you on that. Just what are some of the challenges as when it comes to these health equity initiatives, and just kind of what is the ability of Cook County Health to kind of take on this larger issue of health disparities?
Yeah, so it's certainly not a lack of desire or a lack of dedication to the mission. It really, I think, ends up coming down to resources. If we really boil it down, staffing, financial resources. Right now, we're working internally to try to kind of refocus, really try to shift our thinking to more of a population health mindset, focus on upstream intervention, prevention, wellness. And that's not a quick change, but we're working through it right now. We've only just started. But I think beyond that, as Dr. Vora was alluding to, really focusing on areas where we internally excel as providers or a health plan, or a public health department, but then also find ways to partner with others to really complement expertise and really try to maximize impact. And I think we've been hearing a lot of that through the panelists. We've from CCH's perspective work with everybody here. So it's really exciting to kind of get to fill in the gaps there and create these partnerships.
Fantastic. And Dr. Makaitis, I want to stay with you for a second. As we talk about these initiatives, can you just talk a little bit about how these are funded? Just kind of how are these projects supported?
Yeah, so it's right now a mix of health system investments. It's ARPA funding as well, and we were allocated dollars from the Cook County government's allocation. ARPA is the American Rescue Plan Act. I mentioned from those dollars we were able to do some grant making for our community partners in the behavioral health space to the tune of $44 million. But right now it's a mix. It's coming from our budget and then also funding from grants and from ARPA.
Fantastic, great. John, I want to go to you on the funding issue. Just how is the work by the H Foundation being supported? Just kind of, and is it enough at this point to do what needs to be done on this front?
So we are very fortunate to receive substantial support from our government partners, particularly the state health department, the city health department, to do the work of ending the HIV epidemic and ending homelessness. One of the challenges, though, is that a substantial portion of that money does come from the federal government. And obviously, we are extremely concerned about what's happening around funding at the federal level right now. We are all, everyone on this panel and beyond, we're all working in the health disparities space. And we are seeing the federal government put in place executive orders that are attempting to ban us from doing DEI and racial equity work, telling us that transgender people don't exist, And in fact, AIDS Foundation Chicago, with our legal partners, Lambda Legal and the NAACP's Legal Defense Fund, have filed a federal lawsuit against these executive orders. Our partners on the lawsuit, the other plaintiffs, are the National Fair Housing Alliance and National Urban League. So it's a really important cross sector lawsuit. And the basis of the lawsuit is, first of all, due process, that we don't even know what the government's working definition of DEI is. So if we don't know what the definition is, we don't know how we might be violating their executive orders that say you can't do DEI. There's also First Amendment grounds for this lawsuit. The federal government and Trump administration wants to erase the existence of transgender people, and we've had federal funders tell us we can't say the word transgender. We can't say LGBTQ. We can only say LGB. And so there's real First Amendment grounds, but we also know that addressing the fact that someone is transgender when, for example, we're providing case management isn't just a nice or kind thing to do. It's really critical to making sure that that individual has good health outcomes. And we know that when, for example, a provider is offering gender affirming hormones, a transgender person's health outcomes improve. And we can see that someone's viral load will improve, or they'll engage in mental health care in a way that they wouldn't otherwise. So engaging in transgender affirming care is really about life and death health outcomes. Ryan, you're muted.
I unmute myself. You think I learned after 4 years of Zoom? John, I'm glad you brought up. Obviously, it's the elephant in the room right now is what's happening at the federal level, and I guess you touched on it already. But can you just talk a little bit more about how some of these efforts, the executive orders and others, how has it affected the work that the AIDS Foundation of Chicago is doing, if it has already?
Yeah, so we fortunately haven't had experienced funding cuts yet, but we feel that they could come at any moment. We just have seen really millions of dollars, many millions of dollars in NIH funding cut for initiatives that are related to diversity, equity, and inclusion, serving LGBTQ people, people with HIV, people who are transgender. Simply because of it looks like a word search that that the federal government is doing. So we are extremely concerned that funding cuts could happen at any moment, and that's putting us and other community-based organizations into a really, really precarious position. It's also, of course, affecting our government partners in a major way with just funding cuts that are happening at the drop of a hat. We're also deeply concerned about cuts to Medicaid and the $800 billion in budget reconciliation cuts that the federal government is calling for. There's those are going to hit Medicaid incredibly hard. And just to use the example of people living with HIV, about 40% of people living with HIV in the state of Illinois, between 15 to 18,000 people, are on the Medicaid program. And we know that if Medicaid is cut, even if 5,000 of those folks lose coverage, it's going to have a devastating impact on the ability of existing systems funded through the Department of Public Health, Cook County Health, to fund the care that those folks need and to continue to provide it. Just taking care of the volume is so we're absolutely going to see a worsening of the HIV epidemic if there are cuts to Medicaid and to other aspects of people's health.
Thank you, John. Well, Darius, I want to go to you. At this point, has Westside United, has there been any sort of impact at this point as far as some of the action and policy changes that we've seen on the federal level?
At this point, Luckily for Westside United, a lot of the things or a lot of the funding that we receive is a little bit more of a private donor situation. However, we do work with 5 hospitals. So, the effect of what's going on at the hospital level does trickle down to us. It also hurts a lot of our community-based organizations because they're looking for federal funding, NIH dollars, ARPA dollars, or any dollars essentially that are out there, state funding, anything like that is always something that we always have to take a look at. We've had some strategy sessions in a few communities on the West Side to talk about essentially that change in language to appease the federal guidelines or just to get yourself in an opportunity for those grants. As of right now, West Side United is currently okay, but I feel like as John mentioned and others, it's all about what happens with Medicaid. If the Medicaid dollars get cut substantially, we're all going to be in a serious situation, especially some of our safety net hospitals. I mean, those folks really use those dollars to keep their doors open and the lights on. So, I'm just not sure what's going to happen, and what happens to those safety net hospitals when we already have transportation issues and other health issues. What happens to those residents? How do they, find a level of access to care? That's what our biggest concern.
Definitely. Dr. Vore, I want to go over to you on that. Especially as we talk about the potential changes in federal funding, whether it be grants or whether there is a potential cuts in Medicaid, just kind of how is IDPH preparing for some of this uncertainty that we're seeing, and just kind of how could that affect some of the work that's being done?
It's a great and a question that we are thinking about every day in the state health department. I think we know, and even if you look at our recent FY25 past budget, that we in the Department of Public Health are 65% federally funded. And even last year's sort of total expenditures were 50% federal funding. And we have the great benefit to pass through some of this federal money that comes to the state health department, like John mentioned, to so many of our local providers, local public health departments on the ground that are doing this meaningful work. And we know that actual or potential reductions in federal staff and funding, they range from all kinds of different programs, from housing assistance, healthcare programs for the LGBTQA plus community, and those things have real potential consequences. What John also referenced is that we also know that the types of information that are communicated are also shifting from how we speak about certain populations to just the clinical guidance that is needed to make health and healthcare decisions. And we're committed, and the governor has been out sort of speaking to a lot of these issues. John referenced Medicaid, of course, and we know how much Medicaid has those public health implications, but around a variety of the kind of proposed changes, it's also, there's only so much one state can do to combat those challenges. Knowing that it's not just Illinois, that the entire country depends on these critical funding programs from the federal government. And there are many states that have much more of their state health department budget towards federal funds. Some as high as 90% of their budget is federal funding. So all that to say, it has been a charge through the state health department, our conversation with our partners in this room, all across different communities in the state. That's how do we think creatively, differently, knowing that there will be real challenge. But as I kind of mentioned at the beginning, the core of this work is so important to all we think about in public health. And despite the challenges, that mission to serve, that mission to optimize our health for all of our communities, especially those that need government and community support the most, that continues to be our charge in what we anticipate to be a growingly more difficult environment.
Absolutely. And Dr. Macias, I want to get your thoughts on this. Just kind of what has been the impact so far, or the potential impact on Cook County Health with some of the changes that not only in federal policy, but in potential changes to federal funding?
Sure. Yeah. Thank you, Ryan. So, obviously something we're watching very closely. We are planning contingencies, different eventualities. We're in a unique position, I think, because we serve as the Cook County's Department of Public Health. We're also a payer and a provider. So there are some scenarios where we're getting triple hit, where if we're losing grant funding, DPH and our provider teams would be directly affected. Medicaid cuts, as we've already talked about, hit both our plan and we're the largest Medicaid managed care plan in the county. So it hits both our health plan and our provider side. And I just maybe want to zoom out. John did a really nice job talking about Medicaid coverage and HIV. However, Cook County residents, 1 in 3 are currently relying on Medicaid. So a third of our Cook County residents are using Medicaid, and it is the largest payer for prenatal care, for births, for long-term care, for mental health services. Just a couple of weeks ago, there was discussion around NIH funding cuts, CDC funding cuts, even SAMHSA funding cuts, so substance abuse and mental health services. And for us internally, for CCH, Medicaid represents over half of our patient service revenue. So we are, very, very diligently watching what's coming and internally doing a lot of planning of different scenarios. We're also in an interesting spot in our strategic planning timing. We're rounding out the end of our 3-year plan and using this year to plan for the next 3 years. So that's leading to a lot of kind of varied conversations around, what the impact might be and what that's going to look like in terms of, the next 3 or so years. It's a little difficult, not really knowing, but we're trying to kind of plan those different pathways. And I also just want to, in terms of Medicaid, again, kind of zoom out. It is, a lot of different proposals are being discussed. And all of them, right, represent some type of a cut, whether it's a repeal of ACA expansion or work requirements or block grants or per capita grants, eliminating supplemental payments. That's going to mean Cook County residents are losing coverage, any of those scenarios.
Definitely. And Dr. Eric Macias, I want to stay with you for just a moment here.
Sure.
Kind of obviously, everyone's been talking about, this work is still going to be important. This work is still going to be important going forward. But then, there's also a lot of conversation at the federal level about, DEI efforts, equity efforts like that. And I was just wondering, do you think that health systems and, groups in the healthcare field need to do a better job of explaining this work to the public and just kind of getting in front of this whole conversation? I'm just curious your thoughts on that.
I don't know if it's explaining or maybe, for us at least executing more effectively. And that's where we're focusing right now in terms of the provision of healthcare when we talk about health equity. But, as well, the work that I referenced right at the beginning around, our pathway programs and lifting up our communities that we serve, I think being ever more intentional and thinking of new ways to engage. I'm not sure necessarily if it's an education or kind of a redefinition. Again, maybe a unique perspective for our system, right? We've been doing this for 200 years before it was even called equity, right? It's been our focus. So.
Fantastic, great. Well, Darius, I want to go to you on that. Just kind of as we talk about these equity efforts, do you think more needs to be done to kind of explain exactly what this work is, what this work is and how it's helping, certain, populations that historically have been underserved?
Absolutely. I just think that it's difficult to try to define something that someone is essentially trying to take away. So, we always have, we have tons of synonyms for words that are out there, but it's really hard to kind of narrow down what exactly health equity is. We started off a conversation, probably pre-pandemic around the difference between health equity and health equality, understanding the difference between that and understanding that everybody's not at the same level. So when you're not at the same level, some folks are going to need a few more resources just to reach the same heights as someone else has because they already kind of started a little further ahead. So we've kind of we've started there, and then we've gone from health equity, social determinants of health, social equity, recognizing that there are just from a small, we'll just give a small example. The difference between someone who lives in a community that has a grocery store or someone who lives in a food desert or now what we call a food swamp, where a food desert, you don't have any grocery store. And in a food swamp, someone has just, a gas station or a convenience store that doesn't sell healthy food their community doesn't even provide healthy produce. So getting people to understand the definitions and the language of that in a full circle manner from health equity to health perspective is something that we need to do. I also feel like in terms of the DEI question or initiatives, we just have to make sure that people understand that it's not only about what people see, it's about how people think. It's about understanding the entire baseline and the skeptical and the structure of what thoughts are and how they're created and made. And then you can get into cost savings and whole health programs and things of that nature as you kind of move forward. But it's really about the structure and the definition of how we all think and perceive things.
Mhm. Fantastic. Thank you, Larry. Dr. Boer, I want to go to you on that topic. I've been reading articles in recent weeks about, organizations like Google and health systems in places like New York that are rebranding health equity initiatives. I know Google is now calling it theirs health optimization, saying that they're caring for all individuals. And I'm just kind of curious your thoughts on that and just kind of, do you think this is going to be a more prevalent conversation moving forward for the healthcare sector?
Well, I think for a variety of different reasons, from, we'll take Google, the optimization sort of wordage. At the core, kind of where I started, right? Why are certain people healthier or unhealthier than others? Ladarius mentioned it too. And then how do we give people the right opportunity to be as healthy as possible? And with that, those are just, it's true, right? We're sort of providing facts that there are certain communities, certain individuals that have those challenges. So I think it's going to be our charge, both from just the pursuit of greater public health, but really for companies such as Google to think about that from an economic argument, right? We all, and there's many efforts around the federal government to be more efficient, right? And more effective and efficient. And part of that is understanding how to maximize the dollars that you spend to get the best results. And that's another way to think about it, right? That's optimization too. And so the goal, and I think you're hearing from this panel, the goal is to try to get as many people in this state, in the various groups that we're working on, to be as healthy as possible. And Dr. Makaitis referenced this of, well, Cook County Health has been working on health equity before it was called health equity. And I think there's often an evolution of how we talk about certain things in a variety of contexts. And I think the most important thing is to ensure the mission of this work, right? To work, understand, be there for our communities, promote the health, especially for those that need the most support from government, from community-based organizations, from safety net centers like Cook County Health and the partners that Ladarius works on. I think that's a goal that we can all rally around at every corner of this state and every corner of the country. And I think that's going to be our purpose, to be able to communicate those messages to different audiences in a variety of ways to try to ensure as best as possible that we all can meet in a place. Because during my travels across the state, we all want, kids in our communities to be healthier. We want to prevent infectious disease from spreading. We all want opportunities to take care of our family members and our neighbors. And How we do that, we'll all have continued conversations about, but I know that that's a common theme that sometimes feels difficult in the environment. But I think my kind of day-to-day conversations and my travels show that there's a real energy around making sure that our communities are as healthy as possible.
Thank you so much. Dr. Macias, I want to go over to you. It would not be a healthcare discussion in the year 2025 if we didn't discuss AI and the rise of technology in healthcare. And I was curious just your thoughts on, on this. And do you believe that technology could help close, some of the, help support the health equity efforts and help close the health disparity gap? Or could it have the reverse effect? Are you worried that maybe it could lead to widening gaps?
I think if we're careful about it, it can close the gap. I think as it stands right now, the LLMs and AI kind of technology, it processes what it knows and what it's fed. And I think a simple example, we were doing some work with one of our commissioners around birthday screening, Commissioner Lowry, and looking through algorithms and treatment protocols for prostate cancer, for example. We had very skewed information that was coming in terms of the studies that have been cited that guides when and how to screen. And just to put a finer point on it, there was a Scandinavian study and then a U.S. study, most of the patients were in which were Caucasian. So we've missed broad swaths of populations in terms of that data sample. And as you dig into the data, it turns out the recommendations are a little bit off. So when you feed that type of information into an AI model, you're going to get skewed recommendations coming out. So I think as long as we can be careful there and understand what it's telling us and where it's kind of driving care, and ensure that we're getting a broader, more comprehensive, data input, then I think it could absolutely help drive better efficiencies, more exact care, and in the long run, hopefully improve the health of our population. But I think if we just kind of let it go, we have the risk of some bad guidance.
Ryan.
Thank you so much, John. Thank you for keeping me honest, John. For that, I'll go right over to you. Just kind of, what are your thoughts on technology's role in the health equity conversation? Do you see it as something that can help, or maybe something that could help worsen some of these gaps?
I think there are some really amazing opportunities in technology to work in new and innovative ways. But certainly with the populations that we are supporting, we see a tremendous technology gap. During the pandemic, I think one of the things that we learned collectively as a society is that internet access at home is not just a nice to have, it's a must have. And so that's something that we've continued to try and support for people living with HIV. And one of the things that we are often providing clients with is cell phones, because when folks are being released from prison and jail, that's the number one thing that they need to go to doctor's appointments, to find housing, to try and find a job, to connect with family. And so there are still so many basics of technology that particularly our clients who are largely Black and Latinx, low income, living with HIV, don't even have. It's challenging to think about how AI models can be helping them. And we also know that there are a lot of folks who are really reluctant to even go on the internet to sign up for benefits. So the gap in technology is very concerning and is probably widening as some of the federal programs that have been put in place by the Biden administration to address some of that are being dismantled by the Trump administration.
Great. Well, Darius, just what are you seeing at Westside United as far as technology and AI? Just what role do you see as in this whole health equity effort?
Yeah, I think AI, to Eric's point, it has to be detailed and intentional in terms of the folks understanding social circumstances. I think we have to recognize that AI is, it's just like every other computer. Whatever you put in is going to spit back out. So we have to be really careful and really mindful that we scrub the data with that whole opportunity, making sure that it factors in every piece of data that we have, even with, CMAP, the Metropolitan Mapping Commission. You can look at some of those demographics and make sure you add those details in as you continue to kind of scrub for what you're looking for, and will give a better source or understanding about median income, housing, transportation, job access to and from work, how close it is. And I think that will help AI get a better understanding of exactly what's going on, community by community, city by city.
Definitely. And Ladarius, I want to stay with you here. Obviously, we've had a long conversation about the importance of health equity and addressing health disparities, but I was just curious, obviously, with a lot of the uncertainty moving forward, just what could be the long-term effects on communities like those that Westside United serve if disparities aren't addressed or if these efforts are hampered?
Um, it could be devastating, definitely. I think the first thing, going back to the safety net hospitals from a broader perspective, I think what you're going to have is more sick people unwilling to go to the hospital because they know they can't afford it. We're already dealing with a lot of people who go to emergency departments for care, not understanding that they should be either trying to go to an urgent care or actually trying to find a doctor to get access to care. So you're going to have more overrun emergency departments. I'm sure Eric is not going to be excited about that with the amount of people who come to his hospital already. So I think just understanding, I think there's a level of miseducation that comes along with this long-term effect of the healthcare strategy in general, putting more access or more of a burden on FQHCs, depending on how many FQHCs we end up having, because it's a federally qualified health center. Just that whole idea, and more clinics will be overrun as well. I just think it'll just be very difficult for everyone. It might even be very similar to what we found with the pandemic and just having that regular food shortage and having folks provide those types of resources.
Absolutely. Great, John. I want to go to you on that. Just kind of what could be the lasting impact if this isn't addressed, and maybe talk a little bit about what it can mean for efforts like the getting to zero by 2030.
So we really have an opportunity with the Getting to Zero strategy to talk about ending the HIV epidemic in the state and to have a healthier population of people in the state of Illinois who have fewer health disparities is incredibly exciting to me. And I want to continue to double down on those goals with our phenomenal partners across the state. We're here today to make sure that we are focused on eradicating those disparities and taking advantage of the incredible, powerful technology we have. And in fact, in probably the next year, we're going to have a injection that folks can take twice a year to prevent HIV, which is just phenomenal. But how do we make sure that that is getting into the hands of everyone who needs it, and that we're taking an equitable approach and not just getting that to white people who have insurance, and particularly white gay men? That's what we need to work to address.
Absolutely. Dr. McKias, I want to go to you on that. Just what could it mean for the populations that Cook County Health serves if, if the disparities aren't addressed, if, health equity initiatives are sort of hampered?
Yeah, I think Ladarius was hitting a lot of the key points. At best case, the life expectancy gaps that we've been seeing, I think will best case remain, if not worsen. We'll see a broadening of those life expectancy gaps. We talked earlier about population health, getting upstream, working on prevention. It gets kind of hard to do that when your local healthcare provider is not around anymore, and you have transportation issues, and you can't get up to the few remaining safety nets who might be able to stay open. Not to mention, as Ladarius said, around payment, right? You're not going to engage in care. You see this where upstream interventions don't really happen when you're not insured, right? So now instead of managing hypertension, we're treating heart attacks and strokes. Instead of treating diabetes, we're dealing with end-stage renal disease and dialysis and those types of, unfortunate outcomes when you don't do that upstream prevention. I do want to call out, I know Ladarius was tongue in cheek a little bit, but our mission is to be here for everybody, right? So we are absolutely, we are going to do, as I've told the team, as much as we can for as long as we can. And as I said earlier, we're planning to pivot as needed as these potential changes are coming.
Absolutely great. We just have a few minutes left here, so I want to start bringing us home here, and I'll ask one final question for each of our panelists. And Dr. Bohr, I'll start with you, and I'll go down the row. I like to think of myself as an optimist at heart, and I want to kind of leave here on a high note. And so, as we look forward, just Dr. Bohr, in maybe like 30 seconds or a minute, just kind of what gives you hope? What makes you optimistic about health equity initiatives and efforts going forward?
Well, I'd say these panelists and the fact that like it is the core of so much of our greater health goals. I think many of this panel, many of the people that are in your audience, right? We are trying to move actively from, as Dr. Makaitis, John, and Ladarius said, moving from that sick care system to that health system. I do think the general move here will still be there. And when you go to that frame to move from a sick care system to a health system, you have to think about disparities. You have to think about equity, even if the language of that is different. And I think the conversations, the on the ground work, the meaningful impact to get to that greater health system, that's there, and that gives me hope as a state health director and as Samir Vora, resident of Illinois as well.
Great, thank you so much, Dr. Vora. Dr. Makaitis, what about you? What makes you optimistic going forward on these efforts?
I think it's the fact that, at least from my perspective, these conversations are happening ever more frequently, especially in the current climate. Much like Dr. Vora said, working with these panelists in all their different spaces, and the fact that we are now seeing at the safety net level a lot more meaningful discussion around upstream care, around preventative care and wellness, really focusing that shift towards population health. And of course, to do that, we have to address all of the things that we've been talking about this last hour.
Great. John, what about you? What makes you hopeful moving forward?
What's giving me a lot of hope right now is the incredible advocacy that I'm seeing from the community. The Trump administration proposed shutting down the CDC Division of HIV Prevention last week. Within 24 hours, my social media feed was really flooded with people saying, call your congressman about this. Within 48 hours, we had a letter from almost the whole Democratic Illinois congressional delegation opposing this change, and it hasn't happened. I think that we really need to remember what happened last time there were Medicaid cuts proposed. We all stood up, we opposed them, we said how they would be problematic, how they would hurt our state, and they didn't happen. So we need to really rely on each other, be great advocates, continue telling the story of the harm that could be done right now, and really lean into advocacy.
Great. Well, Darius, I'll let you close us out here. Just what gives you hope moving forward?
Thank you. First, the panelists here, just having these conversations, but honestly, it's the residents and the community. They've been doing this work forever. They've gone through the ups and downs, many administrations, whether it's been presidents or mayors or county commissioners, and they've always found a way to continue to serve the community. So I think that's no different here. I think we've all essentially are looking to be more collaborative and have a more connected and collaborative impact as we move forward in this space. And that truly gives me hope that we can, kind of get through this, get over this side of the mountain into a better promised land for all people looking for better healthcare.
Wonderful. Thank you so much to all our panelists who joined us today. This has been a great conversation. And thanks again to everyone who joined us today for this. Just want to give everyone a heads up. Health News Illinois' next event will be April 15th in Chicago as we look at the efforts to address prescription drug cost. More information on that can be found on our website, healthnewsillinois.com. And with that, wish you all a great rest of your day and a great rest of your week. Thanks so much, everyone.